Good day, and welcome to another HIMSS TV Digital Checkup. My name is Bill Sawicki. I'm features editor with Healthcare IT News, a HIMSS media publication. Today we'll be digging into population health and where it's headed. My guest is Sita Kapoor, CIO and co-founder of HealthEC. She recently was awarded the Indian Achievers Award for her contributions to leading the charge for population health management solutions and data analytics. Welcome, Sita.
Thank you very much. I appreciate this opportunity to speak about the subject that I'm passionate about, healthcare and IT infrastructure, and how we can collaborate to have a better health system overall in our country soon.
Excellent, excellent. So let's jump right in. I have a few questions for you today, Sita. First of all, you use the phrase population health 4.0, and you define it as the recognition of health as a global entity and the focus on identifying and eliminating health disparities, unnecessary costs, and comorbidity. Further, you say that there are 4 items on the Pop Health 4.0 capabilities checklist. The first is managing chronic conditions that have been neglected. I'm hoping you can elaborate on this aspect of Pop Health 4.0.
Absolutely. HealthEC has been working in the pop health space with the ACO's value-based contract for the past 7+ years. And having lived the change in the way we are starting to approach healthcare, we felt Pop Health 4.0 would be perfect for us to start talking about. The first one being the chronic care management. That is the basics. If you think about the new CCM program that CMS is also paying for, which they're already starting to implement, is saying that people with chronic care management need to be addressed so that they do not become more costly or they don't end up in the ER. So to try and find those cohorts and find care plans and programs to address it upfront will help save dollars, patient safety, and will help make these people healthier. So it's a win-win.
So let's move on to point number 2 of your Pop Health 4.0 checklist, which is ensuring equity. For example, vaccines, social determinants of health surveillance, disease prevention, and community outreach. What must healthcare organizations be doing here?
So it is very important that healthcare organizations don't work from within their 4 walls. We need to break those silos in our space of healthcare, which means is we need to come out to the communities to see what are the problems in that community. Now we can say we want to do chronic care management, but if a person doesn't have the means of getting their medications or their vaccines or getting to a primary care facility or to get the test done, we've kind of missed out on what we really need to do as a community to be able to prevent, the increasing healthcare issues. So healthcare equity, we found, was very important. And sometimes it's just a matter of informing them where to get the services. So there's a lot of education that goes along with the second point, but it's very important that it be done at the community level. And we've seen, for example, with the vaccines also, correct? COVID, we all have lived through it. And it is an eye-opener that what we have been saying is proven, that we do need to make sure we have a very well knitted, integrated community to take care of the people that we are trying to promote healthcare for.
Number 3, the third item on your Pop Health 4.0 checklist is how we can support our health systems, particularly the providers, in proactively addressing population needs. What do you mean by this?
Very good question. So as we start thinking of, all of us are patients, or we know someone who's a patient. All of us have gone to a doctor. What did we just say? A doctor, a physician. They are the what I would call the most important component to take care of us, whether it's the doctor, the hospital, the urgent care. We can label them in a different ways. What has happened in our healthcare space was we started moving that within insurance companies and people who were not in touch with the patients. So the value-based care programs that are coming out are really taking the money and putting it back to the providers for them to now reach out and manage those patients better. That is a clear indication that we need to be able to bring the care back to the community, to the providers in the community that we live in. All of us will go within, say, 20 miles of where we live to get healthcare services. How do we make sure data in bite, meaningful way, actionable data can get to them for them to take care of the population? Now, if you give them 10,000 patients to manage, how do you identify the 1,000 or the 100 that they immediately need to get to? For example, with COVID, we found that we had a very big oncology group and they were struggling. They were like, we know our patients are extremely susceptible and their health is critical. They're high risk, they're cancer patients. How do we reach them? All right, we have 10,000. How do I get to the 100? Because I only have 2 care managers who can make the call. Okay, I'll make it 4. How do I get to that granular number of population? So how do we get this data to our providers for them to provide the care, the outreach, or whatever services they need to better improve the health outcomes?
What is needed, for example, integrating necessary public health and healthcare infrastructure into an organization's population health programs? Please explain what needs to happen here and how.
Yeah, this is I feel, a very important topic. Social determinants of health, health and human services, we are not integrated. Nowhere close to being integrated the way one would think a modernized society would be, or IT world would be. So as we work by state, what we are starting to find out is that these data sit in silos. That means people who are on multiple health and human service programs are sitting in different areas. Bringing all of that together along with their specific providers who are going to be providing the care is so critical, especially if you look at what is happening with behavioral health right now. Given what we all went through last year and behavioral health becoming more and more important, how do we start to integrate some of these, all of them, as a matter of fact? And we have a couple of pilots going on in a few states where we are starting to bring it together. Think of COVID, all the immunization data is sitting in one silo. All the people that need support, food stamps or housing, are sitting in different silos. But eventually, it's their health we need to manage to make them, happier, to make them better citizens of our country. So it is extremely important that we start at state levels or county levels, start to think of integrating all these services. There are, like in Prince George's County down in one of the counties with Dr. Carter that we're working very closely and starting to create referrals to them. So that if you get someone that has been discharged, immediately you know what are the services they need and immediately inform them so that within hours, not weeks, they are getting that service they need that will now take better care of their health, better outcomes, net, better cost. So, it kind of ties everything together if you truly start thinking of pop health as what we need to do. So community is important, providers are important. Breaking through, one of the biggest policies that need to be coming into our being is removing the silos. Seema Verma's talked about it also. How do we make sure people are comfortable with sharing this data and not feel, oh no, it's my data, I'm not going to give it to anybody. But we need to share this data, of course, with legislation, with privacy, all those rules that we have put during the Tiger team way back in 2011, 2012, when we were talking HIPAA and everything. So keeping all of that in mind, we need to break through some of these silos, especially at the point of care, when you need to see the data for that particular person to allow the proper care, to reduce their risk, and to improve their health, and eventually reduce cost overall.
This was a great discussion on population health. I really want to thank my guest today, Sita Kapoor, CIO and co-founder at HealthEC. Thank you very much, Sita.
My pleasure.
And to all of our HIMSS TV viewers, stay tuned for another digital checkup coming soon.